Looks pretty.
Good morning, everyone. My name is Maya Luria with TMC for Seniors. Today we are talking all about nutrition and the anti-inflammatory diet Put Out the Fire. You may be watching us on our YouTube channel or our Facebook page. Please feel free to leave any questions for the end of the presentation. But meanwhile, I want to thank Mary Marian. She is a PhD with the U of A Nutrition Department for being with us today. We have a great program with Mary that we have been running actually for a few years now. We have some different nutrition. We have her students actually will provide nutrition appointments with us. So this is a way to sort of kick that off. So Mary is going to start by talking about the diet, and then we can talk a little bit about the end on how the appointments are running as well. So welcome, Mary.
Thank you, Maya.
So let me go ahead and I'll put your presentation up for you so that you can see that. And you can go ahead and get started.
Okay, welcome everyone. Thank you so much for coming, and I hope this provides some information for you regarding the anti-inflammatory diet or an anti-inflammatory eating approach. As I know, this is becoming more popular and I get lots of questions about this. So we'll have plenty of time at the end to go over any questions that maybe I don't address. So next slide. When we talk about inflammation, I think everybody knows if you got a cactus needle in your finger that it's going to usually get red around the site. It could get a little puffy and swollen as more blood comes to the site where you got the cactus needle in your finger or your foot. And then it also can swell up a little bit. And this is just normal. This is the normal, what we call acute inflammatory response. But wait. Thank you. And this certainly can turn into chronic. Let's say that site gets infected and then you end up having more challenges with it. Or sometimes people, especially with their feet, step on something and you don't notice that you stepped on something, and then the next thing you know, you have a big open wound there. That results in chronic inflammation, and it may be more difficult to heal than acute inflammation because it's a longer inflammatory process. And then the third type of inflammation is called low-grade inflammation. And low-grade inflammation is kind of like a fire in the body, that it's smoldering. And if you were to check lab tests, one of the labs that could be checked is called high sensitivity CRP levels. And that would show you that you have some type of inflammation going on. You can certainly have chronic low-grade inflammation going on. And we'll talk about situations where that's more common. But acute tends to clear up fairly quickly. You get that cactus needle in your finger, you pull it out, you clean it up, and within a couple days, probably, you don't even know that you had that wound. Next slide. These are conditions that are associated with chronic inflammation. They could either be a result of chronic inflammation or they could promote chronic inflammation, and some do both, like coronary artery disease or CVD at the top there. So CVD results from chronic inflammation in the arterial wall, and we'll talk a little bit more about that. Diabetic complications. So you're walking around with bare feet, you have numb feet, you don't feel that you stepped on something, and you could end up with an open wound in your foot, and then you end up with chronic inflammation. If we talk about cancer, some cancers go into remission. Some people are getting treatment for cancer that it's there, it's not going anywhere, but it's not spreading. And that's another, I would say, example of chronic inflammation. And then you can just see that other of these conditions are associated with chronic inflammation, and they can be a result of chronic inflammation that ends up leading to chronic inflammation once the condition gets established. Next slide. This is just, this isn't like a memory test or anything, but I just wanted to show you that at the cellular level, a lot of research in nutrition is looking at epigenetics, and you've probably heard of precision nutrition, precision wellness, and a lot of the studies are looking at the cellular level, and this is just an illustration of different signaling and pathways that occur with dietary intake. And so there's a trigger point called NF kappa beta or NF kappa B. And this can get turned on or turned off. And if it gets turned on, then you can see it can go down the pathway where it affects the DNA. It can damage the DNA, which obviously can result in increasing your risk for various diseases, but it also can turn on what's called the inflammatory pathway. And if you were to do a research study and actually measure some substrates that are reflective of the inflammatory pathway, you could measure some of the indices that you see there, COX-2 or different cytokines. We don't do this in clinical practice. This is more research related, but if maybe someday part of our metabolic panel, they'll be looking at these cytokines, and then they can say, yeah, you do have an inflammatory process going on. Next slide. Or we can look at other common, what we call biomarkers that are readily available when you get a metabolic panel. So if you have an elevated white blood cell count, that typically reflects inflammation as well as infection. You could measure CRP levels. CRP is C-reactive protein. I already mentioned that. It's not on a regular metabolic panel, but it easily can be measured. And in some chronic inflammatory conditions, your physician or provider may regularly be checking CRP level. And then usually if you're getting what we call a Chem 20 panel, there's going to be an albumin level on there. And albumin levels, if they're low, then we usually look and see, is there any level of inflammation going on? If we have a CRP level, then we can see kind of like the yin and yang. CRP would be high, albumin would be low. And then we would know, okay, albumin's low because of an inflammatory process that's reflected by CRP. The problem with inflammatory biomarkers is that we don't have a gold standard. We don't know which one is the best one to use. And we know if you're looking at clinical studies related to, let's say, dietary intake, but people are exercising and people lose weight, it's hard to ferret out why, if the inflammatory markers improved, was it just a function of weight? Was it a function of exercise? Was it a function of all three of them together? And so that's why sometimes it's really a challenge to study inflammation related to lifestyle. Next slide. So chronic inflammatory conditions that are increasing in our country are the conditions that you can see on the slide there. Now, I don't know if you've heard of metabolic syndrome, but it sort of is a risk factor for developing CVD and type 2 diabetes. In metabolic syndrome, we look at 5 characteristics. So we look at HDL levels, we look at triglyceride levels, we look at blood pressure, we look at waist circumference, and we look at glucose levels. So there's 5. You need to have 3 of them to be diagnosed with metabolic syndrome. And if someone has metabolic syndrome, they may already have type 2 diabetes and they may already have cardiovascular disease. But it's one of the screening approaches to letting people know that they are at high risk for cardiovascular disease or diabetes. Non-alcoholic fatty liver disease is increasing in our country because 70% of the adults in our country, are either overweight or obese. So this is becoming more common. RA, many people have probably heard of RA. It's a chronic inflammatory condition. And then cancers, as I already mentioned, are affiliated with being a chronic inflammatory condition. Next slide. So this is metabolic syndrome. These are the exact cut points for what we look at to determine if you have metabolic syndrome or not. And you can see that the interventions that we usually recommend are weight loss, physical activity, as well as many times patients would probably be put on statin drugs to help bump up their HDLs, and blood pressure medicine if they have hypertension, and then certainly diabetic medications if they have a fasting glucose level that equals diagnosis of diabetes. Next slide. This just illustrates how CVD or coronary heart disease develops. So you have inflammation in the arterial wall. It could be because you have high blood pressure or you have high glucose levels that damage the arterial wall. You get these little tears in it. And then part of our immune system is reflected by something called a monocyte. So the monocyte gets activated to the inflammatory spot. Inflammation isn't a normal condition. We want to get rid of it. So the immune system is activated. The monocytes come and they get into the arterial wall because LDL levels can get in there. When the LDL levels and the monocytes, which turn into macrophages, when they're both together in the arterial wall, the monocytes tries to get rid of the LDL level because it's not supposed to be there. And when they connect, they form something called foam cells. And foam cells start to build up in and on the arterial wall, where you can see all the way on the right-hand side of this illustration that you start to get plaque buildup. And then obviously, eventually the plaque can occlude the vessel and you end up with a heart attack, which damages the heart muscle. So it's a low level of inflammation that starts. It becomes chronic, low-grade inflammation. And then the negative sequelae is the plaque buildup and then potentially occlusion of the whole vessel. So next slide. And then this just illustrates the process as well. And then obviously this can primarily affect your the arteries around your heart. And once they get occluded, then they can cause a lot of damage. It also can happen to the arteries in your legs. And some people get what's called peripheral vascular disease. And then they need to maybe have stents put in to improve the blood flow to their feet, or they could have a bypass of the occluded spot. Okay, next slide. And then this is just a picture of what we call NASH or hepatic steosis. And steosis is just a term that says there's a lot of fat buildup. So on the left-hand side of the slide here is a nice healthy liver cell. And then you can see on the right-hand side there that there's a lot of fat in there. Look at all the white that's in there. The only way you know if you have this condition is to have a blood panel done. If what we call your liver function test, your LFTs are elevated, then that's a signal that there's some type of inflammation or process going on in the liver. The gold standard is that you have to get a liver biopsy in order to see the fat buildup. And right now, the only intervention we have to cure that problem or improve that problem is weight loss. Next slide. So let's talk about diet. And I always look at it, what are we looking for? Disease prevention or disease management? And if we look at the bullet points here, this is probably nothing you haven't seen before. But these are all the suggestions that equal an anti-inflammatory lifestyle. And lifestyle equals modifiable risk factors. So that means we have some control over improving things so that we can prevent them from worsening. And I'm going to go through these one by one. So next slide. When everybody's probably heard about their weight, they think about their weight, and we know that when you have excess fat, especially if it's in the truncal region or in your midsection, this type of fat is associated with producing more of those cytokines that I mentioned before, those pro-inflammatory substrates that promote an inflammatory environment in our body. And you can see on this slide here all the medical conditions related to a lot of the different types of cancer. I already talked about cardiovascular disease. We know that type 2 diabetes, for the majority of people that are diagnosed with type 2 diabetes, it's related to excess adiposity in your midsection. And then I just went over non-alcoholic fatty liver disease. And so that's why maintaining a healthy weight is really important. And I'm not saying that you have to have a skinny weight. It's just a weight where your blood pressure is good, your serum lipid levels are good. If they're checking a CRP level, that your CRP level is reflecting a low level or no inflammatory environment in your body. So next slide. When we look at the prevalence of self-reported obesity in the country, you can see this is from 2018. This slide just reflects, if you put together the maroon color and the orange color, you can see that this just reflects in these regions that over 30% of the people are obese. So we're not talking about just being overweight, we're talking about obese. In the West, where the prevalence of obesity is a little lower, you can see that we're a little less than 30%. But then if you broke it down based on specific areas, then obviously this could change because you could have a higher concentration of obesity in some areas. And this, we've been talking about this since the late 1990s, yet body weight in this country continues to be a problem. Obesity rates continue to increase. Next slide. So this is just an illustration reflecting how body weight is tied to inflammation. So if we look at on the left-hand side, that if we're looking at the fat cells, they look like just little fat cells. There's nothing in there. So there's like those no black spots. And so you can see that the anti-inflammatory, if we're looking at balance, it's more towards anti-inflammatory environment versus a pro-inflammatory environment. Then as the fat cells get bigger because they're storing more fat, those little black dots in there are the macrophages. So the fat cells, as they get bigger, they activate the immune system because the inside of those fat cells start dying. They're not getting the nutrients that they need. And so the macrophages are recruited to clean up the dead cells. And that's one reason why we start promoting an inflammatory environment, that the macrophages make cytokines. They make those pro-inflammatory cytokines. And you can see in the middle there, the arrows reflecting that a lot of the pro-inflammatory substrates are increased. And the problem with this also is that the very top one there, that's called adiponectin, it decreases. And adiponectin is an antioxidant. And studies have shown when people lose weight, if they need to lose weight, adiponectin levels start to increase and the pro-inflammatory mediators start to decrease. And then if we move all the way over to the right, you can see that the fat cells are bigger. There's a lot more macrophages in there, and we just have more of an inflammatory environment. And that's why obesity probably increases the risk for all those medical conditions and diseases that I've already talked about. So next slide. So unfortunately, the animations didn't come out in this slide, but what I wanted to show you was that we all know how popular Starbucks is today. And even if you don't go to Starbucks and you go grab a afternoon or late morning or an early morning coffee, you can see that the calories and the fat can almost be equal to a slice of Domino's pizza if you have pepperoni on it. And the bottom line about this slide is a lot of people are drinking beverages that are providing as many calories and grams of fat that are equal to a meal. Yet we don't tend to count beverages as a meal. We don't think about the calories that they might be providing to our diet. And that's probably one of the biggest contributors as far as weight gain continuing in this country. Not only are we still eating a lot of fast food, and now that we've come out of COVID, people are going back to kind of their old eating habits. We want to get out of the house, right? But we're also going back to Starbucks, or we continue to go to Starbucks as we were going through the pandemic. So the bottom line is you have to think about what kind of liquids and beverages are you drinking during the day. And another one I'm going to talk about later is alcohol. Alcohol also, it can be a good source of calories. Okay, next slide. So physical activity is part of the triad to promote an anti-inflammatory diet in addition to body weight. And then we'll save talking about diet for last. So next slide. And this just shows you the benefits. Everybody knows that exercise or physical activity is good for us. And it's because it can help repair DNA. It can help the cells respond more sensitively to insulin and bring down glucose levels so you don't have hyperglycemia. You want to control your glucose levels, even if you don't have diabetes, because as I mentioned before, high glucose levels circulating in the body can damage the arterial wall and then start that inflammatory process and plaque buildup. And just in general, it decreases the inflammatory environment, and it may actually help people lose weight. But even if you don't lose weight, it can help decrease the inflammatory environment in our body. And it could be walking, it could be doing strength training, if you like hiking, it could be anything. The bottom line is to pick something that you like. Next slide. And then when we think about certain diseases, you can see here that it decreases, in general, exercise can decrease the risk for a lot of cancers, but you can see in this slide that it can have a significant impact on reducing your mortality and decreasing or increasing the length of time that the disease, if it comes back, that it comes back. And then you can see that it also improves your LDL levels, HDL levels. I already talked about glucose control, and it also can bring down CRP levels. And then we also get other benefits that it just improves quality of life. Next slide. So let's talk about diet. Next slide. I don't know if you've heard about blue zones, but there's been a number of areas globally identified where longevity is longer. And in the United States, it tends to be around the Loma Linda area in California. You can see there's a couple places on the East Coast as well. You can see down in Chile and Argentina and lower parts of Africa and Australia. And the bottom line is that it's not only diet, but it's a number of attributes, as you can see on the right-hand side of the slide here. And it's looking at lifestyle and not just diet. And when we talk about diet, it's more plant-based diet. People are exercising or just they're physically active on a more regular level. They have lower levels of stress. They have more family time and time with their friends. So the quality of their lives is just better. And that's why when we talk about lifestyles and inflammation in general, you need to really look at the whole picture. You can't just bring it down to one thing. And I think that's what some people in our country just focus on. They just obsess over diet, and then they go on crazy tangents, and they're not paying attention to what are the basics that are healthy in the diet. Are you exercising at the same time? Are you just focusing on your weight? And of course, we talked about weight and the role of weight. So any weight control or weight loss certainly can improve the inflammatory picture. But this just shows you that looking at the whole picture can potentially be affiliated with longer longevity. Next slide. So again, going back to this slide, I've talked about the first couple things. I've talked about body weight. I've talked about physical activity. So now let's talk about actually what our diet should look like in terms of what we should eat and what we should drink. So next slide. I don't know if everybody's heard of the DASH diet. I know you've heard of the vegetarian diet and probably the Mediterranean diet. But if we look at commonalities in these diets and compared to the dietary guidelines, which has been marketed as my plate. But the bottom line here is no matter what kind of AKA diet you go on, these are more approaches or eating styles or behaviors that have been associated with improving longevity, decreasing mortality and CVD risk for type 2 diabetes, and some of the other medical conditions that are associated with chronic inflammation. And the bottom line here is they're plant-based. And it doesn't mean when I say plant-based that you can't have any animal protein. It just means that we're building more of our dietary foundation on whole grains, fruits, vegetables, nuts, and seeds. So next slide. And this was a great study that was done back in 2013, and the results came out in 2018. And it looked at different facets of the Mediterranean diet. So you can see there were a lot of people enrolled in this study, and it was done in Italy, and it was a prospective randomized control trial, which is the strongest evidence or the gold standard as far as study design when we do research studies. The problem with a lot of nutrition studies is they come from observational studies. They're following a group of people, and then they observe specific things like, oh, if you exercise 150 minutes a week, you seem to have less risk of the chronic diseases. So that's why this study was so strong and so important. So it had a lot of people. They looked at 3 different diets. So you can see that they looked at a Mediterranean style diet where the intervention was that those subjects in that group, they added 4 tablespoons per day of extra virgin olive oil. The other intervention group was, instead of consuming olive oil, these individuals added a 1/4 cup of nuts to their diet per day. And it was a mixture of different nuts. So a 1/4 cup of nuts is pretty easy to do. If you make a little cup with your hand, that's usually about a 1/4 cup of nuts. And then there was a control diet. And back in the 90s, people used to be put on low-fat, low-cholesterol diets all the time to lower their risk of CVD. And so that's why a lot of times it's looked at as the control diet, because there's still a lot of recommendations to be on a low-fat diet, and I'll come back to that. What was kind of interesting was in this study that there was no calorie restriction. They basically said, keep doing what you're doing, but if you're in the intervention groups, we want you to add these things to your diet. There were no specific recommendations for physical activity. It was kind of like, just keep doing what you're doing. When they looked at average weight reflected as BMI, the majority of individuals had a BMI of over 25, so that was more associated with, on average, people being overweight. They followed people for 5 years, and that was another big, strong strength of this study, is that they followed these people for a longer period of time. Not a lot, but some of the trendy diet marketing recommendations come out of diets or studies that have been only done for like 4 weeks or 8 weeks or even 12 weeks. Not long enough for people to actually stay on the diet. Do we know if they can stay on the diet? And then you're not usually going to see significant changes in biomarkers at 4 weeks, maybe weight, but definitely not usually biomarkers or blood pressure. So anyways, what they found, this was pretty significant, that there was a lower risk of having an MI, stroke, or death, whether you were in the group that consumed more olive oil or you were in the group that consumed the nuts compared to the control group. So the control group obviously had about a 30% more likelihood of having some CVD event. And then they found the individuals in the extra olive oil group had significant reductions in developing type 2 diabetes as well as metabolic syndrome. Next slide. So why do we think fruits and vegetables, whole grains, nuts, and seeds are healthy for us? It's something we've all been hearing since the beginning of time. And when people go on trendy diets, like the keto diet, which is basically 75% fat, they're missing rich sources of all the nutrients you can see on the slide here, because fruits and vegetables and whole grains, nuts, and seeds provide both vitamins, minerals, as well as something called phytonutrients. And so I've listed some phytonutrients on the slide here. Everybody's heard of some of the carotenes, beta carotene and lycopene. You've probably known that green tea is healthy for us. Everybody knows an apple a day will keep the doctor away. But the importance here is that there are what we call the phytonutrients in food that are not in supplements typically. And that's the value of eating real food, is because you get so many more benefits from food that have antioxidant benefits. And I put this illustration here specifically to demonstrate that we get different phytonutrients based on the colors of our fruits and our veggies. So for example, the red and the blue, they provide something called anthocyanins. Anthocyanins are just antioxidants and they're phytonutrients, compared to orange and yellow and green. Then you're more likely to get the polyphenols or the carotenes. If we were to eat cruciferous veggies like broccoli and cauliflower and kale and cabbage, you're going to get something called isothiocyanates. So that's why it's important to eat a diet with a lot of color in it, because these foods all bring different nutrients to the table that then can hopefully translate to having an anti-inflammatory diet that lowers the environment in your body. So next slide. And so we all know that processed foods are not good for us. And the reason why is because they tend to be higher in saturated fat, trans fat. They're more pro-inflammatory compared to the plant-based foods that tend to have healthy fats. So omega-3s maybe. They may have monounsaturated, polyunsaturated. They have fiber. Fiber is an antioxidant. People don't think about that. They think about it related to having regular stools. But fiber is important because it can decrease the inflammatory environment in our body. And then we'll talk a little bit about herbs and spices. So next slide. And everybody's probably heard about fish oils. A lot of the studies have shown that eating fish provides, especially if it's EPA and DHA, that it can provide more anti-inflammatory cytokines versus and icosanoids versus arachidonic acid, which is in the middle here. And things that are more processed in the grocery stores tend to have more arachidonic acid in them. And so what about fish oil supplements? The literature keeps going back and forth. And right now, it seems like that if you have a low fish diet, a diet that's low in EPA and DHA, and you're not taking statin drugs for elevated LDL levels and cholesterol levels, that you may benefit from fish oils. If you're taking a statin drug, statins also have an anti-inflammatory benefit. And so fish oils don't seem to increase or lower your risk for cardiovascular events if you're already on a statin drug. Will it hurt you? Probably not. But whether you get added benefit from it is really hard to tell. So next slide. So let's talk about red meat and processed meat a little bit. Does it create an inflammatory environment in your body? Some studies have shown yes, and some studies have shown no. So it's really difficult to know specifically, and it probably depends on what kind of red meat that you're eating, because a lot of our red meats today are pretty lean and low in saturated fat. So if you're eating like pork loin or even pork chops, or maybe you're eating some kind of steak besides T-bone or a ribeye, then those are really low overall in saturated fat. But red meat and processed meat increase the risk for colon cancer. And the American Institute for Cancer Research still has this as a strong promoter, or it's strongly associated as a probable or convincing factor that increases the risk of colon cancer. And colon cancer is the number 3 cancer that people die from in the US. So it's very common for people, especially as we get older. And why is it? What does it do? If it doesn't really promote an inflammatory environment, why would it increase the risk for something like colon cancer? And you can see on the slide there, it's not really known, but it's thought that the preservatives or the heterocyclamines that are produced when the meat is cooked, especially at high temperatures, or the iron content in the meat, those can all increase the risk. What if I eat processed meat that has no additives in it? Will that decrease our risk? You would think theoretically it would. Do we know? We don't know. So next slide. And when we think about vitamins and minerals, so I already talked about it. Yeah, you want to think about, am I not getting certain things in my diet? So if you never eat oranges or strawberries or let's say spinach, then maybe your diet's a little low in vitamin C. We know that your diet is not going to give you enough vitamin D unless you probably drink 4 glasses of milk a day, or you have salmon with a couple glasses of milk every day. And I'll talk about vitamin D in a minute. So sometimes people do need supplements, but I want to just go back to thinking or reminding you that food supplements, I mean, you could take a fiber supplement, but it's not like getting the fiber in real food. And some of the supplements have antioxidants in them, but they don't have an array of the phytonutrients. And we'll talk about botanicals. So next slide. So vitamin D, I know everybody's heard about vitamin D, even though we call it a vitamin. Vitamin D is actually a hormone that's been associated with lots of different functions in the body. And there's a lot of research going into vitamin D right now. And so it's been kind of like the darling as far as the vitamins in the last, I would say, 10 years. And everybody knows that maybe they should be taking a vitamin D supplement. Maybe they know that if you're out in the sun, especially in the summertime, you might have higher vitamin D levels, but we don't know what our vitamin D status is unless we have it checked. And it's not on any regular blood panel. So when your doctor usually orders labs, vitamin D has to be specifically ordered. And so for you to know whether you should be taking a vitamin D supplement or not, you really should have your vitamin D level checked. Will it hurt you? Usually vitamin D supplements, they come in a variety of doses. So if you're not taking more than, I would say, 5,000 IUs a day, unless your doctor has recommended that you take higher levels, you probably would be fine. Do we think it's the end all to be all that that marketers claim it to be? Well, some studies are showing, yes, it might be an anti-inflammatory agent, and it might decrease your risk of certain things, but some studies are showing yes, some studies are showing no. And so it's good that it's an active area of research because there's a lot we still don't know about vitamin D. So next slide. One of the things, though, that we do know with certain types of cancer is that higher vitamin D levels through supplementation may be associated with maybe not curing your cancer, but promoting longevity. And so this was a study that was just published in 2020, and there's been a lot of up and down about, especially with colon cancer. This what you're looking at here is this table is looking at studies that specifically looked at vitamin D supplementation in colorectal cancer outcomes. And the bottom line there in the green box is that it favorably is a benefit for people who have had colorectal cancer to take vitamin D to get their vitamin D level in the normal range. And so you would have to, again, ask your doctor to have your level checked and then just see what the normal range for that lab is, because it really can vary from lab to lab sometimes. So in terms of taking supplements, again, I think vitamin D is a pretty good bet to take, and it's safe. So next slide. A lot of people ask me about turmeric or curcumin. So curcumin comes from the turmeric plant. Again, it's been the little darling for botanical supplements, I would say, at least probably the last 5 or 10 years. A lot of research is ongoing in this area as well. You can see that it potentially has a lot of benefits related to its mechanism of action. It's mostly been marketed for decreasing inflammation. It seems like it's likely safe. And if you want to take it, you probably need to at least take it for 4 weeks before you would see any substantial benefits. Sometimes people tell me, oh, I took it and after the first week I noted some benefits, and that's great. But sometimes it takes people a little bit longer. Most studies show that you usually have to take a supplement at least 4 weeks, many times maybe 8 weeks before you start seeing any benefits. So next slide. The problem with turmeric is that it can have interactions with some medications. So you do have to be careful, and it has interactions with a lot of the more common medications people on. So like some of the blood pressure, if you're on Plavix, some of the statin drugs. And so the more meds you're on, the more careful you have to be about taking botanicals. Bioavailability is really low, so you have to make sure that you're getting a supplement that either has a higher amount of curcumin in your supplement, or if they add piperine to it, which is a derivative of black pepper, is that increases the bioavailability. And bioavailability just means it actually gets into your bloodstream and it actually can go to the cell and get the benefits that you want. Next slide. So resveratrol, which is in red wine and in red grapes, this has been hyped up for a really long time as well. You can see here phase 1 studies are in progress. Phase 1 studies are cell culture or animal studies. And a lot of times, again, benefits are purported in all over the internet and in magazines and other sites that say, oh yeah, studies have shown that you can get lots of benefits related to something. And a lot of times you have no idea what studies they're talking about. And it could be that they really are cell culture or animal studies. And a lot of times the benefits found in those mediums do not translate to humans. So if you're ever wondering about a supplement, there's a number of websites like the Linus Pauling website with Oregon State is a great site to go to, or Memorial Sloan Kettering. They have an herbal library. Both of those sites are free, and they have a lot of good evidence that can help you decide whether you should be taking a particular supplement or not. So next slide. Potential harm with supplements. We found in the SELECT trial, which was a trial that was done in the late 1990s, where it enrolled over 30,000 men who were at least 50 years or over. They did not have prostate cancer at the beginning of the trial. That was the primary outcome that they were evaluating. And they looked at risk for prostate cancer or incidence of prostate cancer. Did men develop prostate cancer if they didn't take any supplements, so they were in the placebo group? Did they take selenium? Because there was some evidence that selenium supplements could decrease the risk for prostate cancer. Did they take vitamin E, or did they take combo selenium and vitamin E? And they found that the men in the vitamin E group had a higher incidence of prostate cancer. And back in the 90s, vitamin E was really hyped up for decreasing CVD risk. And so this trial showed that it can be really harmful, and you probably should not be taking a vitamin E supplement by itself. Obviously most multivitamin supplements are going to have vitamin E on them, but it's at such a low level, it's not going to hurt you. But taking a therapeutic dose of vitamin E can, if you're a male, increase your risk of prostate cancer. And then it also can increase the risk of heart failure. And you can see some of the other evidence on this slide that selenium supplements, 200 micrograms a day, potentially can increase the risk of type 2 diabetes. And then breast cancer survivors, if they're taking a slew of supplements that have beta carotene, vitamin C, niacin, selenium, coenzyme Q10, and zinc, that it could decrease survival and decrease the length of time that it takes for the disease to come back. So next slide. Okay, so this is just a summary that I found related to from the Institute of Medicine. It's a nice summary of what should you be doing to decrease your risk for there's heart disease. So we have the Institute of Medicine recommendations up there. We have AHA is American Heart Association. We have cancer, and we have kidney up there. So this is just as you can see, the recommendations are not different from organization to organization. But a lot of times, depending on who you're going to, so let's say you're going to your cardiologist, they may only look at the American Heart Association guidelines. If you're going to your oncologist, they may just know about the cancer guidelines. And so that's why people get overwhelmed sometimes, is that there's all these different guidelines out there. But when you boil it down, they're pretty much all the same, is that you should just have a balanced diet and it be more plant-based with lots of variety of different fruits and vegetables and whole grains and the nuts and the seeds. And then obviously you have to be concerned about calories, because too many calories then just end up promoting more body weight. So next slide. And then when we talk about supplements and what's our goal per day, I listed on the slide here is that if you're looking for something like potassium, and I included potassium because a lot of people are on potassium supplements, and we know that potassium is important in blood pressure regulation. And a lot of people are on low potassium diets, and maybe rightly so because they're on dialysis. But if people maybe upped their potassium intake to the levels that they're supposed to be consuming on a daily basis, as you can see there, it differs a little bit based on gender, then potentially they wouldn't need a potassium supplement. Iron is something we have to be concerned about after the age of 51. For most people, iron requirements go down. Men, they're always at 8 milligrams of iron per day. So if you're eating a lot of fortified breakfast cereals and you're taking a regular multivitamin, let's say like Centrum, you might be getting too much iron, which then iron can be a pro-oxidant, which can increase the inflammatory environment in your diet. Women know about calcium and vitamin D. I've talked about folic acid is important for women of childbearing age. And then vitamin C is an antioxidant. If you take more than 250 milligrams of vitamin C a day, you're probably just going to pee it out, and because we don't have a way of storing vitamin C. But as I mentioned, if you're not eating these kinds of foods that are good sources of vitamin C, maybe you're not getting enough in your diet and you might need that supplement. So next slide. So translation to food, what should I be eating? And if you think about developing a template as you're going through the day, I know you don't want to keep a food log or food diary. Sometimes they're really helpful, though, to see what you're doing and make you think about what you're doing, because most of us are in robopilot mode when it comes to eating, and you're just grabbing stuff because either you're hungry or you're in a hurry or whatever. But as you go through the day, these are goals to just think about. When you're picking something for lunch, did I have any fruit for breakfast? Well, my goal should be a minimum of 2 servings of fruit for lunch or per day. If I didn't have any at breakfast, I probably should have some fruit at lunch. Same with the veggies. Most of us are not used to eating veggies for lunch unless you get a salad. So just think about having something that's quick and easy that you could have as a side to go with whatever else you want to have. And it may be that you just have to cut down on what you typically have for lunch. So if you're having a whole sandwich and you're worried about adding these things to your diet because now you're going to be eating more calories, maybe you have to have a half a sandwich with a piece of fruit and some veggies instead of a whole sandwich and that bag of chips. So if you develop just a mindset of, as you go through the day, have I had any fruits? Have I had any veggies? Most people are eating too many starches because we eat sandwiches, we eat breakfast cereal, we eat bagels, we eat chips, etc. And so if you're trying to cut back on calories and you're not on the keto diet, which usually kind of inhibits you from having any kind of starches, usually if you stick to 3 or 4 servings a day, that's considered a healthy intake. You can see the recommendations for added sugar in the diet, and then supplements only as needed. So next slide. Alcohol consumption. The old adage has been 1 drink a day for women, 2 drinks a day for men. When we talk about cancer, though, as you can see on the slide here, there's a number of cancers that are associated with alcohol intake. How much alcohol is okay? We don't really know. We just know that any alcohol on a regular basis, so like a daily basis, can increase your risk for these different types of cancers. So it's just something to think about and contemplate. How much alcohol am I drinking over the course of a week? So next slide. So other considerations are think about sleep. We know that people that are not sleeping well, or they're only getting 5 or 6 hours of sleep a night, they tend to have weight problems. A lot of times people are grabbing things for energy, and usually it's not things like fruits and vegetables or whole grains. Same with stress, is when we're stressed out, if you're an emotional eater, you tend to maybe grab comfort foods that can kind of make you feel better. And then oral health, we want to think about periodontal disease increases is associated at least with an increased risk for CVD. And then glucose control. I've already talked about the role of glucose or hyperglycemia in promoting inflammation. So last slide. So this is just a recap. I talked about the importance of weight. When you think about physical activity, what is our goal? 150 minutes a week, both of aerobic, and you should have strength training at least a couple days a week to maintain muscle mass, because as we get older, we lose our muscle and we need less calories. I talked about the dietary pattern, and I talked about the role of supplements. So thank you so much for attending, and I'm happy to take any questions.
Thank you so much, Mary. That was a ton of information that was so valuable. So I appreciate all of that. I especially love the slide that talks about how you can get, what foods you can get your nutrients from, which is really important so that people understand. We did have a question come in about what would be a healthy alternative to those lattes to maybe avoid the calories if, people are they really love to have those drinks now from Starbucks. So what could they do as an alternative?
So when I go to Starbucks, because I like those drinks too, I think about, I like their teas, especially this time of year. So I might get the tea instead. I haven't been there in a while to get the tea, so I can't remember. It's kind of a red color. It doesn't have any sugar in it, but it's really thirst quenching and it tastes good to me, so I might get a tea. I do love caramel lattes, so I would look at it as a treat, and then I factor it in to the rest of the day. So let's say I treat myself to one mid-morning or mid-afternoon, then I don't usually grab it. I usually plan it into my day, so I know I'm going to get it. And then I can alter my intake the rest of the day so that I'm eating maybe less at lunch or less at dinner. Maybe I'm exercising more that day. I'm going to the gym, and so I know that I'm going to be able to burn it off. Those are different strategies.
Okay, great. Now let's talk about also fish. Can you ever have too much fish in your diet?
Yes. So you don't want to be eating too much tuna. And I would say specifically albacore tuna, because it can be contaminated with mercury. So sometimes people will have, I'll have a tuna sandwich every day for lunch instead of the lunch meat. And you want to not consume more than 12 ounces of tuna a week, especially for women who are thinking about getting pregnant or who are pregnant.
Okay, and are there other fishes that they should consider eating, on a more regular basis than others then as well?
So going back to the omega-3s, the EPA and DHA, we know that there's fish that are higher in those amounts. So everybody's probably heard of salmon and then trout, and tuna is a good source as well. So maybe thinking about having at least 2 servings of those types of fish a week and having 3 to 4 ounces as your serving size.
Okay. I just had a question come in asking about selenium. Does that lower your cholesterol level?
I have not, I'm potentially, but I haven't seen any evidence that it would be beneficial for that.
Okay, great. Now I do want to talk a little bit just about our nutrition advising appointments that we do with your students. So can you sort of explain a little bit about how, what an appointment would be like? I know they are free. You can make an appointment with us. And I am going to put up here the phone number as well to make a nutrition advising. But if you might just explain what that process is like.
Yeah, great. And I really encourage you to sign up if you want to talk about your nutrition, because this is like personalized nutrition. And so I'm working with senior dietetic students this semester. And how our system is set up is that if you sign up for an appointment, somebody will be assigned to you. They will call you, because we limit our appointments to 1 hour. And we can't, because they're just practicing, they can't get all that information from you in 1 hour. And so I have them call you ahead of time to get certain information. For example, they'll ask you, what are your goals to get out of the session? Height, weight history, medications, laboratory data, kind of background information. And then they will schedule an appointment with you. We're doing all our appointments still virtually, but they'll be done on Zoom unless you prefer just to be on the phone. And in our 1 hour, I will be there with them, but they will be asking the questions and providing the recommendations. And once we meet, they'll get a diet history from you. What are you eating? And then they'll circle back to what your goals were and tie it into what you're eating, your lifestyle, your supplements. Maybe you have a supplement question. And then I'll be there to make sure that they're giving you factual information and help out that way if I have to. So again, they're free. They're 1 hour. They give the students an incredible experience because they're really smart, but they haven't gotten to work so much in the real world, especially with COVID now. And because I'll be there, I will make sure you get factual information.
Right. And I do want to say that we have only received fabulous feedback from everyone who has done these appointments in the past. So I would certainly encourage anyone who is interested in finding out some more about their nutrition and their nutrition goals to make an appointment. They can make those appointments through our office. The phone number is 520-324-1960, and I've had it running on the bottom of the screen here as well. So I appreciate anyone, we love that we have this partnership and that we're able to do these appointments. I really do think that it helps both the students to get some more experience in just speaking with somebody, but it's also so valuable as well for our seniors to get that information. So it's really a great program. So that is all the questions I have so far. And Mary, I just want to thank you again for being here. This was great, and there was so much valuable information that was packed into your presentation today that I know it's going to really help somebody. Tomorrow we are going to be live again at 2 o'clock, and so that is on Thursday, September 23rd. We are going to have Dr. Cody Kramer here from Pima Heart and Vascular. He is going to be speaking about peripheral arterial disease and the signs, symptoms, and treatment. So we hope we'll get to see everybody again tomorrow. And thank you again, Mary.
Thank you so much. Bye, everyone.